very much, James. I don't think we're going to have time for questions just now, but obviously catch James out in there if you do have any questions. Thank you so much. So our next research paper is entitled Organisational Contributors and Intervention Strategies to Address Burnout in Veterinary Nurses. And I'd like to introduce Angela. So Angela, originally from the UK, qualified as a veterinary nurse in 2003. After 9 years in general practice, she moved to Australia, working in emergency and critical care and leadership roles while she completed her veterinary technician specialist qualification in ECC. In 2016, Angela joined the teaching team for the Bachelor of Veterinary Nursing at La Trobe University in Melbourne. Alongside her teaching, she developed a passion for leadership, completing a Master's in Management. Angela is dedicated to the advancement and support of veterinary nurses and is currently completing a PhD focused on preventing burnout in veterinary nurses.
Thank you, and can I just say a very big thank you to the MMI team for allowing me to come and share my research with you all today. So I'm going to be sharing a number of studies with you today in a very short period of time, quite quickly, so strap yourselves in. The reason that I conducted these studies is because in my time working as a veterinary nurse leader, I saw both vets and vet nurses burning out around me and wanted to do what I could to help, but really struggled with finding information that would support me to support my teams. Most of the information I could find was about how individuals could manage their own burnout. Excuse me. And on top of that, a lot of the information that was out there was focused on burnout in vets and vet students and very limited information about burnout in vet nurses. So I did what any sensible person would do in that situation and started a PhD. So just a very quick overview of burnout, just to add context to some of the studies I'm going to be discussing. Maslach and Jackson describe burnout as comprising of 3 dimensions. So emotional exhaustion, which when that's increased, describes feelings of emotional drain and that sort of inability to really function particularly well. Depersonalization, which when increased, leads to feelings of negativity and cynicism towards other people. And then personal accomplishment, which when decreased, leads to feelings of ineptitude or a lack of ability to perform your job particularly well, which is really important to understand. That's a perceived feeling of perceived ineptitude. It's not actually a realistic change in your ability to do your job. It's just a feeling that you're not being able to do it to your normal standard. And these 3 dimensions can be experienced individually or in any combination in people that are experiencing burnout. So more recent research has suggested that burnout exists on a continuum, ranging from, to orientate myself to figure out which side was which then, engaged, which is not experiencing any signs of burnout at all, through to burnout, which is experiencing burnout or signs of burnout in all 3 of these dimensions. And so within this continuum, not in a linear fashion, but there are 3 profiles that exist. So the ineffective profile, which is specifically linked with that reduced personal accomplishment, the overextended profile, which is linked to that increased emotional exhaustion, and the disengaged profile, which is linked to that increased depersonalization. And the reason that these are important is because each of those different profiles are linked with workplace factors that contribute to those. So for example, the ineffective profile might be linked to a lack of ability to use your skills or a lack of opportunities for progression. And the overextended profile might be linked to too much work or excessive workload. And so much like our blood gases can help us to narrow down potential diagnoses. I have to shoehorn ECC in there somewhere, sorry. These profiles can help us to narrow down what the workplace causes for burnout may be in our nurses that are experiencing them or individuals that are experiencing them. So we know that burnout originates from the workplace. The World Health Organization defines burnout as a syndrome of chronic workplace stress that has not been adequately managed. But susceptibility to burnout can be influenced by individual factors, and these are varied and change between whoever's recommending them, but some of them include age, gender, and this is particularly important in our vet nurses because, as we've just said, 97% of the veterinary nurse workforce are women. And so from that perspective, we know that vet nurses may be more susceptible to experiencing burnout. But really important to understand that those individual factors, although they influence your susceptibility to burnout, they're not the cause of burnout. So the drivers of burnout actually originate in the workplace. And the reason this is important is because if we actually really want to tackle burnout head on, we need to focus on workplace changes rather than changing the individual. And then just briefly touching on vet nurses, obviously vets and vet nurses work in the same environment, they're exposed to the same sorts of things, but their role expectations are quite different. They perform different tasks, they have different expectations on them, and so it's likely that those drivers of burnout are going to be different for vets and vet nurses, which is why it's important to look at vet nurses separate to vets when we're looking at causes of burnout. So the aim of our research was to gain an understanding of burnout in vet nurses and develop a set of evidence-based organisational burnout reduction strategies. It just rolls off the tongue beautifully, that one. And to do that, we first wanted to identify organisational risk and protective factors for burnout in vet nurses, and then understand the barriers to successfully managing these. So we've done 3 studies. We've done a survey of vet nurses, we've done a Delphi study with vet nurse leaders, and we're just finishing off a workplace evaluation survey. So study 1 aimed to identify the common burnout profiles of vet nurses, determine workplace contributors to burnout, and explore vet nurse perspectives on burnout to contributors to see whether what vet nurses perceived were causing their burnout was what we were seeing from the other data. We used an anonymous online survey. We included qualified vet nurses that were working in practice. We used snowball recruitment primarily through social media, but we also contacted veterinary nurse representative bodies around the world and asked them to share it with their members. And the study included 81 open and closed-ended questions, including questions from the Maslach burnout inventory, the areas of work-life survey, and the brief daily stresses screening tool, which allowed us to account for non-workplace stress within our study. So we received 187 completed survey, which in the grand scheme of all of the vet nurses in the world is not a huge number, but it gave us quite a useful amount of information. They were from 9 different countries, and looking at the demographics of those respondents, they did reflect the professional workforce composition within the countries that they came from. We analysed the data using the instrument scoring keys for the MBI and the AWS that I talked about before. We also ran Pearson's correlations, hierarchical multiple regression analyses to identify the relationships between burnout and workplace factors. And then we used a combination of inductive and deductive content analysis for the qualitative data. So our results showed that the participants showed greater levels of burnout in all 3 dimensions compared with other occupational groups, including medical professionals, mental health professionals, and vets. However, we do obviously acknowledge that there's a risk of response bias. We had a relatively small sample, so it's quite likely that a lot of the people that responded to our survey were experiencing burnout or had a particular interest in burnout. Within the profiles, 34% or 1/3 of the respondents fell into that engaged profile, so no signs of burnout at all in those individuals. But that meant that 2/3 of the respondents were experiencing burnout in at least one of the 3 dimensions, and 12% were experiencing burnout in all 3 of those dimensions. And the most common profiles that we saw were the ineffective profile, which, as if you remember, is related to that lack of ability to utilize your skills, or perhaps a lack of opportunities for progression, and the overextended profile, which relates to that excessive work, or that high workload or unmanageable workload. So that told us a little bit about causes. We also identified 10 key workplace contributors to burnout. So I'm not going to talk through all of those, but you can have a read through, and probably nobody in the room, particularly the vet nurses in the room, are not going to be at all surprised about any of those. I don't think that any of those were a surprise to those of us that were doing it, and probably what we came out of that thinking was that, fantastic, we've just done an international survey and found out all of the things that we knew anyway, wonderful. But I guess the question that did come from that was, if we know all of these things, and a lot of these were identified in the systematic review that we had done prior, in the very small amount of existing research on burnout in vet nurses, is if we know all of these things happen, why are we not doing something about it? What is stopping us from doing something about it in the first place? So a summary of study 1, we know that vet nurses have high levels of burnout or are at risk of burnout. We know that high workloads and a lack of support were found to be key contributors to burnout, and that existing workplace initiatives targeting vet nurse well-being are not adequate within the workplace. But we needed to do further research to identify what barriers exist and develop some targeted well-being strategies to address burnout. So that brought us on to study 2, which was a Delphi study. And the aim of this was to identify those barriers to addressing burnout and determine the feasibility of proposed solutions for addressing the burnout drivers that we'd identified in study 1. So this used the Delphi technique, which is, for anybody that hasn't heard of that, which I hadn't before I did it, is a technique that uses a panel of leadership or a panel of experts that contribute their views around an issue or a number of issues, and then revise those views over subsequent rounds until agreement is reached across the panel. So we recruited leadership experts, leadership and well-being experts through our professional networks. We used an online mixed method survey through subsequent rounds to gain their data. Ideally, it was going to run from 2 to 4 rounds, and the results from each round inform the questions that are developed for the next round. And we set consensus at 75%. So consensus can be set, there's a range of recommendations for that, but we decided that once we got 75% of the panel in agreement, then we would determine that was consensus. So results from this study, we recruited 40 participants, and we had some attrition throughout the study, but we still ended up with 32 complete at the end of the study. The research suggests that participants above, I think, 25 show stable results, so we were happy with that. The participants were from 5 different countries, so we were happy that we were getting information that was related to the veterinary nursing around the world. We ended up doing 2 rounds, and after 2 rounds we got consensus, so that was where we managed to stop. And our data analysis for the qualitative data, we used, again, conventional and directed content analysis. We grouped the responses to form solution statements, which then in the following round were then rated on a 5-point Likert scale for both ease of implementation and effectiveness at addressing burnout. And that quantitative data was analysed, and then we provided inferential statistics to the participants so that they could compare and provide responses to the next round. So what we found in round 1 is we developed information, or the data showed what the barriers were for addressing burnout. So these we split into external barriers, so beyond the scope of the clinic's ability to manage things, and internal barriers which were within the clinic. So those external barriers included cultural norms, and one of the key ones that kept coming up was around leadership. So I think that was around the fact that in the veterinary sphere, we tend to promote people into leadership positions because of clinical expertise, rather than because of any particular desire or capability for leadership. And that's not only potentially an issue in and of itself, but because it's a historical cultural thing, we also lack in those mentors to then help support those new leaders coming through. And also regulation. Obviously our research spanned a number of different countries, so there are countries, including Australia, that don't currently have regulation of vet nurses, but even in countries that do have regulation, there was confusion or perhaps a lack of confidence or knowledge about exactly what the regulation said. So that was a key barrier to utilising our vet nurses. Internal barriers included the characteristics of the workplace and team, so this was things like the financial capacity of the clinic to make changes, the existing levels of burnout in the team, so if you've got a team that's highly burned out already, then introducing changes is a lot for burned out people to manage on top of their existing issues. The quality of leadership in the team, openness to change. We're humans, we don't tend to like change very much. So the openness to introducing change, aspects like that existed within the clinic. We also developed solutions. So we developed 40 proposed solutions, and that was 4 for each of those 10 problems that we'd identified. And within those solutions, we developed a range of actions that can be implemented to try and achieve that solution. So we took those through to round 2, and those solution statements were rated both for ease of implementation and effectiveness. For ease of implementation, we had no consensus pretty much across the board. I think we may have had one or two where people were kind of in agreement, but not really. And the qualitative data showed very clearly that that was because it would depend on the individual clinic. So going back to those characteristics of the workplace, what are the barriers within the workplace to implementing those changes? And that's going to change very much and influence whether a solution is successful. With effectiveness, we had the other way around. So we had consensus on 39 of the 40 solutions straight away. The one solution that we didn't have consensus on was rated as ineffective, so we removed that one. So we ended up with a list of recommendations that we developed. This is an example of one of the 39 recommendations. And this is around the workload being too high. And the reason that I have chosen this one is because I love the fact that the problem is that the workload, and the solution is improve staff retention. So, you know, it's good that we had a whole international study with a load of experts to say, just keep your staff, because we couldn't come up with that ourselves. But the key to the solutions is not necessarily in the solution itself, but more in those actions. So if we look across the other side at the actions, the recommendation is how we can improve that staff retention. So, for example, by implementing stay interviews, various different things like that. So for each solution, we developed a range of short, medium, and long-term actions that can be done within the clinic. So this is one of those 39 that we developed. So summary of study 2, we developed those solutions with actionable strategies to address those 10 key burnout risk factors. We identified multiple barriers to burnout prevention, both within clinics and across the industry. And the effectiveness of the strategies we identified will depend on the workplace climate. So further research is then required to support vet clinics in selecting effective strategies. So this is where it was supposed to end. But like all good, super keen people, I was like, well, we can probably squeeze in one more study, right? So that brought us on to study 3, which is the workplace survey study. So the aim of this one is to develop a survey that can be used by vet clinics to identify the existence of burnout risk factors within the clinic, and evaluate that organisational climate, those barriers that are going to prevent them from or change the ease of implementation for all of those solutions. So the idea is that it helps to guide which solutions you choose to implement in your clinic. So we've developed a cross-sectional online anonymous mixed method survey. So I think it's 34 questions. The first 10 questions identify your risk factors, and then the following questions identify the key areas within your clinic that might prevent you from addressing that and help to guide towards which solutions are going to work. We've just finished testing it in 6 different vet clinics. So we've managed to try it in a range of clinics, both private, corporate, charity, country clinics, city clinics, a little bit of everything. We recruited those clinics through our professional networks. And we're at the stage now where we've just sent, so what we did was we sent the questionnaire out to the clinics, got all the results back in, evaluated those, and then provided the clinics with a summary, which was their top 3 risk factors, any barriers that they were going to or likely to experience in making changes, and then recommendations taken from those solutions that we had as to what they could implement to try and reduce the risk of burnout for their vet nursing teams. And we're just running an evaluation questionnaire at the moment, which asks people to identify or to respond to how accurate the results were and how useful they think the recommendations were. And so far, that's coming through very positive, which is amazing. So overall summary, with the research that we've done so far, we've identified the 10 key risk factors for burnout in vet nurses. We've identified those barriers to addressing burnout, both within clinics and industry-wide. And we've now, hopefully, developed a functional survey that will allow clinics to identify risk factors within their clinic and direct them towards selecting solutions. So we hope that this research is going to improve well-being for vet nurses and increase retention and provide better support for teams. Thank you very much. Sorry to have talked and thrown so much information at you so quickly. This QR code links to my website that's got the publications of all of the research studies that we've done if anybody wants to know more. And I think I talked for too long, so if anybody wants to ask questions, please find me outside. Thank you.